Session is being recorded. Okay. Okay. You think we're ready to get going, Frank?
I think we are. Yes.
Okay.
Thanks, Frank.
Frank has asked me to kind of basically go through and do the overall demo of the system so we can talk about the features and some of the new stuff that's been added since you guys have last seen this. I know Nick and some of you have already seen most of this, so a lot of it's going to be repetitive. I apologize for that. I'm going to try to go through and just touch on the salient points so we can maybe get this done in about 30 minutes. As we're going through it, please feel free to stop me and ask any questions as we get going here, because as you know, I kind of get this thing going like a drink out of a fire hose here. Are there any questions before we get started?
No, we're good.
Okay, let's go ahead and get rolling then. Pardon me. Okay, as you know, we're going to be talking about the VMSG dashboard today, and one of the key elements, I think, is the fact that this system was literally created with public health, specifically for the needs of public health. And it was created as a operational planning and execution system. We define operational planning as being able to take any of your plans all the way down to the specific activities to be executed in a specific time frame by a specific group of people, measured in a specific way. Now, in our experience over the last 15 years of doing this with public health, most of the plans that we see get down to what we call the objective level, which is still a target. This is what we want to accomplish. We want to reduce smoking in schools by 10%, but very seldom is there a set of activities that are going to get you there. So what we'd like to be able to do is encourage you to get all the way down to that activity level so you have a specific set of things that you're going to be doing to get it going there. The other thing we like to be able to do once we get to that level is be able to continually go through this plan through what we call the PDCA cycle, plan, do, check, and adjust, or the Deming cycle, where we're going to continually move that plan forward and keep track of the real results versus the plan as we're moving forward. We're going to show you a live example of how that works in here. Obviously, you guys are very familiar with the accreditation process. The system is currently being used by 83 health departments across the nation. I believe 5 of those are state health departments. And in each and every case, who's taken it through the accreditation process has been fully demonstrated. So it's well known in the market. For standard 9.1, one of the things that we do encourage people to do, however, is, and I know you guys are going to be into the reaccreditation process very soon here. The reaccreditation process is more stringent around the standard 9 related information because they want you to get it deeper into the organization. They want everybody in the organization to have an input on the performance management. And when we talk about everybody in the organization, we also talk about external partners as well. So those people who are involved in your chip and your CHA process typically can have direct input into that process to keep the information up to date in the system. Again, we're going to talk more about that here. Just as kind of a review, we define performance management pretty simply. And number one is that operational planning process. For everything that you're going to be doing out there, you're going to have an operational plan, be it very simple or very complex. But that operational plan is going to take you all the way down to that activity level that says, here's the specific things we're going to do to be able to accomplish this. So having good, solid operational plans is key. Number two is being able to monitor the performance of those plans throughout their life cycle. And when we monitor performance, we look at it at multiple levels, one being a micro level, and that's being a very specific activity over a period of time. Number two would be more of a macro level, being able to look at, for instance, the whole department or an entire plan or an entire division in the department on a one-screen basis here. And then the other thing is being able to share that information with the public, with the board, with senior management, that sort of thing, through what we call VMSG Public. And then the third piece of it is continually improving that plan by walking it through this PDCA cycle over and over and over. So that's the 3 levels that we consider to be performance management. It's a pretty simple process. As I had mentioned, the core of the system is an operational plan. This operational plan was developed over the course of many, many years in conjunction with Arizona State University here in Phoenix and several public health departments here in the Southwest. So the very top of each plan is going to be your organization or your health department. Underneath that, we're going to have a set of groups, which is just your org chart. It's the divisions, the offices, and programs, how they all relate to one another within the organization. At the top level of every plan are what we call services or initiatives. These are things like the strategic priorities in your strategic plan. At the top level, just saying what we want to accomplish, basically. Underneath that, we have every service you'll see has a set of goals, every goal a set of objectives, every objective a set of activities. And that's just the project plan, if you will, on how we're going to do it. Again, where we see the most strategic plans, especially, as they get down to that objective level. And the objective level is still defining what we want to accomplish, like I mentioned, like reducing smoking in schools by 10%. That's not a set of activities that's going to get you there. So we like to take it to that next level and define specific activities that we're going to do to get you there. We have a little demo organization we created called USA Public Health. And what I'm going to do now is walk you through an example. And like I say, some of you guys have seen this already. Some of it will be new for you. But I'm going to toggle over to the system here. Across the top, you see these tabs. If I were to take that pyramid and lay it on its left side, it would be these tabs: organization, groups, services, and then you can barely see goals, objectives, and activities. They get selected as I go and select the service, then the goals will highlight and so on down the pyramid there. So I'm going to go to my groups tab here. I'm going to select our community health division. So now I've selected everything on the tabs to the right will be specifically related to community health. So I've got a set of services in community health. For the purpose of this demonstration, we're going to focus on the Safe Kids program at the top there that you see. So I'm going to look at a set of goals for Safe Kids. And again, for this demo, we're going to talk about promote and provide child passenger safety education and resources to partners in the community at large. And we're going to be talking about the car seat program as we move forward here. At this level, we start assigning status flags to every planning element here. So in this case, we have green, yellow, red, and gold. Green, everything is moving forward. Yellow is caution. Red is, oops, we got a problem, something stopped. And gold means a successfully completed goal in this case. And as we go down, a successfully completed planning element. So it allows you to track very simply and very graphically how each of these planning elements is moving forward here. The other thing we have at each planning element level is a set of notes, and that's specific to this planning element. The notes are typically just an ongoing dialogue about this planning element. For instance, if I were to change that green flag to a yellow, I might put a note in there so that, based on the current spending rate, we're going to run out of money before the end of the fiscal year. I put a note in there so anybody else looking at that, multi-user system, many people can look at it. Anybody else looking at that can just go to that note and say, oh, I understand what's going on here. I don't have to necessarily call Fred to get the information here. Pardon me. So the objectives for that specific goal are by June 30th, 2018. So we're getting very specific, SMART format, specific, measurable, attainable, realistic, and time-based. So by June 30th, 2018, we're going to distribute 20 car seats per week to families through various programs. So what we've done is a little analysis in our geography and says that, based on the income demographic that qualify for the car seat program, we believe that our demand is going to be about 20 car seats a week. So that's the particular objective we're going to accomplish here. We're going to assign a person responsible to make sure that that happens. In this case, it's Diane Cox. Diane is the objective leader, so she's probably a project manager, program manager, maybe a division manager. Not necessarily the person that's going to accomplish all the activities, but going to be responsible for making sure that they get accomplished. Very simple to change that. Just click on the little down arrow here, pop open this window, and I can select anybody else in the organization to be my objective leader. In this case, we'll leave Diane as our objective leader. I'm going to drill down to the specific activities for this objective. And we've got a set of activities that, if accomplished, is going to get us to that objective. Number one is we're going to establish a funding stream for the Safe Kids program for 20 car seats a week. Car seats aren't cheap, obviously. Somebody's going to have to fund this. Typically, it would be from the Safe Kids program, although it might be from a benefactor or a foundation or something along that line as well. Down here, we have a description of the activity. Over here, we have a performance metric, and that performance metric is merely how do we know when we've successfully completed this activity. So we're going to establish a funding stream. Once we've acquired funding for 20 car seats a week for the next year, we've completed this activity. We have an activity type. There are 3 types. Project-based is what we're going to talk about right now. Got a slide in a minute that'll talk about the other 2. Project-based activities are the most simplistic. They typically have a beginning date, ending date, or they always have a beginning date, ending date, and a percent complete. So within this time range, I'm going to accomplish this activity, and I'm just going to measure it by how far along we are in a percentage. Again, down here, I have the notes. The notes is just, again, that ongoing dialogue about this particular activity. Over on the left side, I have the ability now to assign teams. So I click on here, and it's going to show me Diane Cox is our team leader. So if I change this lead flag, it's just going to allow me to do 1 team leader. And I can have as many team members as I want down here. So in this case, I've got a team of 2 people accomplishing this activity. Diane is our team leader. Diane's responsible for making it happen. Mara is helping her to do that. Over in this right column, we have the ability to track FTEs. This can be critical, well, not critical necessarily, but very, very good to have in many cases. Number 1 is doing kind of a cost-benefit analysis. What are the resources required for this particular activity, and what's the benefit of doing that? So what I've done over here is Diane and Mara have both decided it's going to take about 4 hours a week during that time frame to accomplish this activity, so 0.1 FTE. If I go back here, you'll see this 0.1 roll up here to a 0.2 FTE for the particular activity. If I go back to the objective, for all those activities, you saw it rolls up to a 0.6 FTE. So what that's allowing me to do, again, is to be able to calculate the relative cost in resources for doing this particular activity, objective, goal, etc. The second activity we have here is going to create a relationship with a local car seat installer. Again, we don't want public health people installing car seats due to liabilities and things. So what we're going to do in this case is form a relationship with somebody who's licensed, bonded, and insured to be able to install the car seats. Down here now we have the ability to assign external partners. So through this list, I can have obviously as many partners as I want down here. And I've assigned Andrea Schoen from Andrea's Car Seat Installation as our external partner here for installing car seats. What that's doing is basically tying Andrea to the team. So she's part of the team now to be able to execute this particular activity here. My next activity is to be able to create demand. So going to our PIO office and having them create an awareness campaign or a marketing campaign, if you will, to be able to get the word out so that people who qualify income-wise to be able to go through this particular program and get free car seats will know that they're available. They'll know to go to Andrea. Andrea will qualify them, and Andrea will distribute the car seats to them. And then the last bullet down here is actually the installation of the car seats. So this is the operational plan, if you will. So let's walk it back through the pyramid now. USA Public Health, as you saw, we selected Community Health Division. The Safe Kids program, as you saw. The goal is to provide car seats to those who can't afford them. The objective is, specific. By June 30th, we're going to distribute 20 car seats a week. And then the activities are find funding, hire an installation partner, create awareness, and actually install the car seat. So this is a solid operational plan that will get us to that objective on up through the pyramid here. So now we're going to walk that plan through the PDCA cycle, as we mentioned. What we did is just accomplish the P part of it, if you will, the plan part. So you saw that we created an operational plan. Now we're going to move into the execution phase, which means we're going to get our funding partner to provide money to Andrea on a regular basis to procure car seats. We're going to get our PIO office to generate the demand so that people will go to Andrea who will qualify them and install their car seats. And we're going to do this for some period of time as we ramp up, maybe 10 or 12 weeks. During this period of time, what's going to happen in the background is we're going to enable real-time planning updates. And what that is an email notification system, a fully automated email notification system. And what that does is on a regular basis, maybe in this case, we set up for a weekly email. It's going to go out to Andrea on a Monday morning, and it's going to say, how many car seats did you install last week? She'll go in and put in that she did 21 car seats last week, save, and she's done. Maybe a minute a week for her to be able to do that. So that's going to happen during the whole period of time. At some point in time, we're going to want to go in and check and see how we're doing against our plan. So at this point in time in the check phase, we're going to go back to our plan here. Our activity is to install 20 car seats a week. We want to see how we've been doing. So what I'm going to do is look at all that information the system's been collecting automatically for me, just by clicking on the little chart button. So what you'll see is that she started out a little bit low, she ramped up, and now she's humming along at about 20, 21 car seats a week, something along that line. The blue line is the information that Andrea's been entering all along. The green line is our target number, that 20 that we were looking at. The red line is kind of our fallback number, saying that if we're only doing 10 car seats a week, we need to look at this, find out what's going on. This is a QA, a quality assurance activity, and a QA activity automatically sets the traffic light for you. So for this 9, it was set to red because it's at or below 10. For the 12, 16, and 19, it's between the green and the red, so it's going to be yellow, and all of these are going to be green. So at any point in time, I can look at that specific activity and look at the traffic light and see that we're on track or we're behind schedule or way behind schedule. So
hey, Frank,
now,
let me stop you for a second. I think you said, like with this, what you're showing us right now, the system is designed to, I would say alerts, but maybe reminders is a better word. Will the system automatically send persons reminders based on target dates they have in the system? Is that pretty much what you're saying there? Then they'll be able to generate reports like this to sort of show the progress?
Yes. Yeah, the email real-time notifications go out on a regular basis, and they're going to be determined based on how you're doing against your particular piece of the plan. So and I'll get into that in just a minute if you don't mind, Frank. Okay. I'll go into the details of how that gets done. But yes, you're absolutely right. Okay, so what we did is just checked our plan against our actuals here using that chart, and now we're going to go into the adjust phase. And in the adjust phase, if there's a requirement to make an adjustment to the plan or the resources, we're going to do it here. In this case, we're running right along exactly what we thought, so we're probably not going to make an adjustment. And then we're going to continue through the cycle again at whatever time we decide. It may be on a quarterly basis, we're going to look at this again and see if we're still on track here. Now, let me take you back to another scenario here. What if the chart looked like this? So we started our ramp up and we got up to about 15 and started capping off about 14 or 15 car seats a week. So now we know that we're not reaching our target. We want to go back and figure out why. So what we're going to do is just go back to our plan and walk through the activities here. So number 1 is establish funding. The gold bar says we've done that. Create a partnership. Gold bar says we've done that. Work with PIO to develop marketing. Big red light. This is where I focus my effort right now. The red light saying we've got a problem. So I'm going to go down to my notes field, take a look at that. We got a note in there that says may not be reaching the proper demographic, only have a demand for 15 car seats a week. Okay, our problem appears to be in our marketing program. So at this point in time, we're going to go address this with the PIO office and explain the situation to them and get their input as to why they think we're having an issue with the marketing. A couple of answers could come back. Number 1 could be that we've done everything as we thought. As we discussed, we've been going to this proper demographic. All these people who make under this amount per year, we've been marketing to, been doing social media and regular media. We think we've got everything under control as far as marketing. We think we maybe just overestimated the market out there. So at that point in time, in our adjust phase, we're actually going to adjust the plan. So we think we're doing everything right. We're going to adjust the plan from 20 down to 15 and continue on through the cycle and see how it goes in the future. The other answer you might have gotten was that we were able to start the program, and then the guy that we had assigned had to go on, say, emergency medical leave. We realized he wasn't coming back anytime soon. We assigned a new guy who had to get off another project. Now he's on it, but he's only been on it for about a week, so we're just ramping up the plan. So in this case, what we did is make an adjustment to the resources. So it could be financial resources. In this case, it's people resources. We substituted one guy for another. Now we're just ramping up the product again. So in this case, the adjustment was made to resources. So if you think about the possible scenarios, number 1 is no adjustment needs to be made. The plan is on track. You're going to continue to go forward. Number 2 is you're going to adjust the plan. If we overestimated, we adjust the plan from, say, 20 down to 15. Number 3 is we're going to adjust the resources, whatever we need to do to get it up to the plan. And number 4 might be that we're going to make an adjustment to both the plan and the resources. So maybe we would move the plan down to 17 and bump the resources up to get us up to that 17. So this is the PDCA cycle, and it's just a continuous process that you're going to go through with each plan to monitor it, make adjustments, and move forward. The nice thing about this is that it keeps your plans up to date in real time, all the time. So you don't necessarily have to go through the planning cycles again because you're kind of always in that planning cycle here. Okay, we had talked about, at the first slide there, we talked about the idea of macro level performance monitoring. So I'm going to take you back to the department level screen, not the top level, and I'm going to go to our dashboard screen. What the dashboard screen is going to allow me to do is, depending on who I am when I log in, is to see everything within my area of responsibility. So if I'm at the department level, I'm typically the health commissioner, the chief health officer, looking at the entire department. So what I'm seeing on this particular, the top left corner is this traffic light, is the number of activities in each status. So we have red, yellow, green, gold down here, and the number of activities. We also have this schedule gauge, which is saying for the plans in this area of responsibility, we're about 23 days behind schedule. We're on average 23 days behind schedule here. Everything on this screen is clickable. So if I wanted to find out what this red light was that's causing us a problem, I can just click on it. It's going to take us right to that specific activity we talked about, which was the PIL office, getting back. So I can then go in and address that activity, get it back to a yellow or a green, hopefully. Down at the bottom of this screen, I can drill down on this traffic light to get more information. If you recall, we assigned activity leaders to each of the activities in there. So now I want to do is see how each activity leader is doing against their assigned activities. Number 1 is I have this last updated column, which says, what was the last date and time this person was in the system updating their information? Just by looking at the colors, I can tell I have 2 of them that were within 30 days and 2 of them that were within 60 days old. And if they're over 60, it would be red in there. Now, obviously, I can look at the specific dates, but just by looking at the color, I can tell I'm fairly real time with my data, maybe a little bit behind. Here's another roll-up of that FTE column, which just indicates how much of an employee's time we're utilizing with these particular activities. So employee utilization here. In this case, I have Diane Cox running at a 1.25 FTE, meaning she's doing work of 1 1/4 people. I might want to take and offload her a little bit because I got Fred who's only doing a 0.8. So if I click on Diane's name, it's going to show me every activity she's been assigned. I can go down and look at them and say, I can reassign these 3 to Fred, get him up to a 0.95, get Diane down below a 1.0, and we're balanced. That's good. Lagging in days is showing me the number of activities that are calculated to be lagging behind schedule. And then again, it's color coded by how far they are behind schedule. The days is the same as the schedule gauge you see up here, but for the individual person. Overdue is just that. Ending date is come and gone, and we're not yet 100% complete. The red, yellow, green, and gold is for the individual person, same as the traffic light up here. So that's view 1 is people. Number 2 would be I can look at my org chart and see how each of my divisions, offices, and programs is doing. And what I'm going to see down here basically is my org chart, and then the same information over here. So I can look and see, if I got one program that's lagging behind schedule, maybe I could go address that with the program manager. And then the third one is kind of comparing everything to your strategic priorities from your strategic plan. So how is the department doing moving towards their long-term vision of their strategic plan? So down the left column here, you see the strategic priorities from our little demo organization here. And then again, the same information. So this allows me to break down that traffic light and get really good information. The other key element is that I mentioned before, it's dependent on who you are when you log in. So typically at the top level, I'm going to select a group. So I might select a group that is community health. And so what I see on the screen then will be everything that's community health or everything that's WIC, for instance. Top right corner allows me to select individual priorities that I want to keep my eye on. So these are objective level priorities here. And I can look at, typically I'm going to watch things that are reds and yellows because if they're green and gold, I don't necessarily need to watch them. And I'm going to look at things that are either typically my responsibility or the responsibility of somebody on my team. to change that, so I don't need to watch this green one anymore. I can just click on it, go down here and select this little flag, turns to gray, go back, and it'll be gone. So it's just that easy to keep track of different things, and you can turn them on and off at will. But typically, this is your login screen in the dashboard because it's going to show you specifically what you're working on. You can see the results without having to go dig through plans and things along that line. I mentioned 3 types of activities. We talked about project-based, very simple, beginning date, ending date, % complete. If I have a target number, so for instance, I have a WIC clinic who's got a target of doing 50 nutrition consultations in the fiscal year. Now I have a denominator. So now when I get asked to enter information, let's say on a monthly basis, the WIC clinic manager gets a email notification. It's going to come in and say, how many nutrition consultations did your clinic do last month? They put in 5 instead of putting in a % complete. It's going to add that to the 20 that's already been collected, divide it by 50, says we're halfway done. It's going to compare that to the timeline and determine if you're on schedule, ahead of schedule, behind schedule, whatever. QA activities is like the one we were just talking about with the car seats. It's a repeating activity. You select the frequency. And what that basically does is set those dates, beginning and ending dates for you automatically. So when Andrea goes in and updates the number of car seats installed every week, it's going to set it to the next week automatically, so it's already collecting new information. The high and the low value is that green and red line you saw on the chart, and the metric type would just be car seats installed. So lots of choices for activities in here as you're putting your plans together. Built into the system, and this is based around the FAB accreditation process. As we rolled out the system, we didn't have this, and we built it because several health departments were having problems managing all the documents here. Pardon me. The accreditation process. So what we did is built document management right in. What it allows you to do is, let's see, this little blue folder icon on every screen. You can attach documents to any piece of any plan anywhere in the system. You can attach it to a user, to a group, or service goal, objective, activity. What it allows me to do is click on that, and it allows me to attach a document specifically to this. In this particular case, we're going to attach it to this service in here. The nice thing about this is if you're manually collecting documents for accreditation or reaccreditation, typically people put them up on a shared drive. So it's on your network somewhere. You've got a FAB accreditation or FAB reaccreditation folder out there. Underneath that, you're going to have the 12 domains. Underneath that, you're going to have the 39 standards. Underneath that, you're going to have all the measures out there. You're going to pile all your documents in there. The only thing you really have to look at in that scenario is the file name. And file names can be cryptic and not necessarily easy to decipher in here. So what we allow you to do in here is you put your documents up on our server, basically. They're all stored on our secure server. You can put in a complete description of the document as long as you want it to be. You can put in any notes about that document. So as you're going through the update process for the document, just put notes in there as to who did what last, that sort of thing. FAB requires that you have specific dates, their expiration dates, if you will, on documents. So, if you have a CHIP plan, it's got to be dated within 5 years. If you have a workforce development plan, it's got to be dated within 2 years, that sort of thing. So the file name or the file date that you get when you're storing a document in your file system is just the last date it was saved up there. So in this case, you've got a specific date that you can mark this document with in here. Then you also have the traffic signal flag. A lot of people use this for documents as red is a brand new document, maybe a template. Yellow is a draft in process. Green is finalized, vetted, signed off. And gold would be it's been potentially uploaded into EFAB. Now, because it was designed around accreditation doesn't mean that's the only thing you can use it for. It's a generic document management system, can be used for anything. A lot of people are using it for grant management. So they're building a plan about getting a grant, going through the grant process, and then tracking all the documentation that you're required to track on your utilization of the grant for FTEs and invoices and that sort of thing. So it's a great place to store all that information. So it's all built right in. You can have as many documents as you want out there. They're all stored again on our secure servers. They're backed up nightly. They're not going anywhere.
Hey, Fred, let me ask. I think you mentioned it earlier, and I was was just thinking. When you were talking about the various reports that the software dashboard will allow you to print, I know in the early stages, when we first started to look at this, you had asked for like org charts. We provided you that. You loaded it into the system. You'd asked for users and like the logos and stuff like that. Is the system designed that if we put a report, that the report will reflect the branding or the logo? Is that why we gave that to you?
Yes. Yep. It's all automatic. So when you generate a report, it's got your logo in the top right corner, and it defines your health department, everything else on the report. And I can show you that in just a minute. I can actually log into your account and show you that.
Okay.
Okay.
Yes.
Three-dimensional planning. This is another tool that allows you to, you're going to have a bunch of different plans in the system typically. What you want to do is look across all those plans for commonalities. So for instance, how are we doing against the essentials of public health? What I'm going to do is tag different pieces of the different plans against the essential public health number one. So now I can go back and say, show me everything we're doing across the whole organization around essential number one, or FAB standard 6.1, or in this case, one of the 31 reaccreditation measures are already in there as well. Your strategic priorities, this is where they come from, is I'm going to tag different pieces of different plans against the strategic priorities. So now I can see how we're doing against them. And the same thing with documents. If I have documents stored all across the system, I can go back and tag those documents against the standards and again, the reaccreditation measures. So I can always go easily find, how many different documents there are for a reaccreditation measure number 31 or whatever. So it's a big overlay across all the plans to allow you to look across everything in the system very easily. And it's done through, basically what you're going to do is go down to you're going to select any planning element in the system, and you're going to go to this little button down here, which is your categorization. And so what you have on the left side is a bunch of different public health categories. These are all editable by you. As an org administrator, you can go in and add more to these, change and delete them, whatever you want to do. But the most public health stuff is in there, like the essentials of public health and accreditation are all here. You can pick as many of these as you want to tag in any planning element. Down at the bottom are all of the FAB domains and standards. So I've got domain 1 standards, plus I have all the reaccreditation measures right down here. So I can tag whatever we're doing against the specific reaccreditation measures as well. So basically you're going to tag the things in here that puts a set of tags on each planning element, which allows you then go back and look at it. This is a question, Frank, I think you asked a few minutes ago about real-time planning. This is the email notification system. And here's what happens. Let me take you to the setup first. So I'm going to go to settings and notifications, and then look down here. Basically, I'm going to turn them on or off here, yes or no. When do I want them to go out? I can go out anywhere from any specific day, every day, or up down to one day a month. In this case, I got the first week of the month on Wednesday, they're going out. It's going to determine whether to send them out if this person has not been in the system in 30 days and done their updates. If they have anything lagging behind schedule as calculated by beginning date, ending date, % complete. And if they have anything overdue, so it's past the ending date there. So any of those criteria gets met by any user, they're going to get an email. And the email is going to go out to both internal and external folks. If you determine the external folks are going to get the email, you determine that, and yes, they'll get the email. We're going to click on a link in that email. It'll take them into our quick update system. Quick update system is exactly that. It allows you to very simply be able to update the information around that specific activity and save it in the system. This system is very key to keeping information up to date, and it was designed to not be a burden to anybody. It was designed to make sure that your updates are done and kept up to date within 3 to 5 minutes a month. So each person who's assigned as an activity leader can be expected to dedicate about 3 to 5 minutes a month is all to keeping it up to date, which really does help in keeping the information live. What's going to happen is, in this case, on Wednesday morning at 2 a.m., the system's going to light up and it's going to take a look at every user in there and say, number 1, have you been in 30 days? Number 2, you got anything lagging? Number 3, you got anything overdue? If any of those is true, they'll get this email. So it shows them why they got it. It shows them all the activities they've had. Here's the status. Here's your contact people, internal contact people that you've assigned. And then here's the link to click on to take you into the dashboard. When I click on this link, it's going to take me to my login page, user ID and password. And then it's going to give me the option here to be able to go into the main dashboard or the quick update system. If I choose the quick update system, it's going to look like this. Pardon me. So up at the top is just the context. So it says under this group, service goal and objective, I have this activity. It's number 1 to 10 I'm going to be updating today. Here's the activity. Here's the performance metric. Then down at the bottom are the fields that I can update. So in this case, it's a QA activity. So basically I have one field and a note that I can put in there. So I can change the value. I can put a note in here, hit this one to go to the next one. This is how it makes it very, very easy for people to update their activities. Again, typically 3 to 5 minutes a month. So I'm just going to walk through all the activities, and log out, and I'm done. Reporting. I will show you the reporting we're talking about here. So reports on everything in the system. Haven't had to add a new report in years because we've added reports over the time that people have requested. So I think we pretty much got everything covered. But if you find something else you need, let us know here. The reports all typically look like this. They have the operational plan report. So this is the Safe Kids program. It's under the Community Health Division, Safe Kids program, goals, objectives, activities, notes, etc. Let me take you back here, and I'm going to log out and log back in and go to your account so I can show you what your reports will look like here.
And while you're doing that, logging out and logging in, Fred, now the reporting, is this where you're going to walk us through again that operational plan report for the reaccreditation?
Oh, yeah, I'll do that. I have to log back into the other account because I haven't got yours set up for that yet, but I can do that very easily.
And I know Gene Calandra, now we said it on that, but I think Nick was actually out that day, and I thought it was a very good walkthrough presentation. So if we have time, if you could sort of just...
Oh, we do. That's going to be about the next thing. I just want to show you the reports that you asked for. Okay. So when I do an operational plan report, so it's always going to, hang on a second. I selected the wrong organization. Florida Department of Health. Here we go. Okay, let's go here. Now let's go to the report. There you are. Okay, yeah, so all the reports will have you up here, and it'll have your logo in the top right corner. And if I say show subgroups, it should show me all of the, basically the organization structure that we put in there for you.
Okay.
Okay?
Okay.
And we go back here. Okay, VMSG Public, this is a reasonably new feature in the system. What this allows you to do is very quickly create static web pages with all the performance indicators that you want to share. So a performance indicator can be created at any level from the group, service, goal, objective, or activity. So I'm going to show you the live page for the Safe Kids program. So each performance indicator forms a row on the screen here. So in this case, we have the Community Health Division, so a group, and it has number of activities that are in each status here, as you can see as I roll over. And then it has the schedule gauge. So just by looking at that, I can say we're mostly green and gold, and we're only 22 days behind schedule for the division here. The Safe Kids program itself, I have the same information, and then I can get down into one of those micro level charts here, so I can look at the number of car seats installed each week here. And by rolling over, I can see the exact detail. You can create, what it ends up creating is this web link for you. And it's a unique web link that you can email out to your Board of Health. A lot of people are doing that before the Board of Health meetings, showing each division basically in there and saying, here's how each division's doing, being able to send that out to them so they can have the information in front of them for the board meeting, that sort of thing. You can also take and post this on your web page to share with the public. Any number of indicator rows and any number of web pages you want to create. No limits on that. Okay, here's what you're talking about. Accreditation project plan. Let's walk into there. Okay, so we have accreditation project plans, which includes all the reaccreditation, by the way, at the different levels. So you got local, state, and tribal. So I'm assuming you guys will be in the state level here. So under the accreditation project plan group, we have a set of services. The first one is the 7 steps of public health accreditation. So when I look at the goals for that, you see the 7 steps down here. So I'm assuming you guys are probably in this stage right here, the reporting stage after your initial accreditation and getting ready for the reaccreditation. And you'll see that underneath here, there's a set of objectives. You got to submit your reports, and then the specific reports that you have to submit are all in here. Also down here, you have the specific domains. So for domain 1, under the goals, you got the standards, plus then you have the reaccreditation measures. And when I go to them, it's going to show me the reaccreditation measures specifically for this domain. And then underneath that, it's going to show me basically the specific documents that you need to be able to submit down here and the process that you have to go through. What you're going to typically do on this is going to assign teams like we did down here at the activity and the objective level. Typically, the objective teams are the domain managers that you've assigned. And then you can assign all of the dates in there so that you can say, you know, before we apply for reaccreditation, we have to have all of our documents submitted, basically. So you can assign the date that you're planning on doing that. And then you can actually use a dashboard specifically for the reaccreditation project plan. So you can anytime look and see exactly where you stand on that reaccreditation project plan. So that's all built in. Very simple to go in and populate, again, all of the dates and the people who are going to be involved in this. And then from then on out, you can use the quick update system to keep the information up to date, because it's going to automatically query everybody who's been assigned in here. Is there anything else you wanted to look at on the reaccreditation project plan?
No, not really.
Okay, great. Quick start. Yeah, we won't dig into that anymore. Okay. And then basically help and information is always a click away. Click on the little blue eye, and it's going to take me, I was on the services screen, so it took me to add managing services. Down here is all the bullet list of things I can do down here. There's a user guide down here, and then there's a 3 to 4 minute video that shows you how to do that. Up here is all the training for the system. So there's 4 levels of training, anywhere between 20 minutes and 2.5 hours, depending on how much you take in there, broken down into 3 to 4 minute modules. So that was pretty much it. Now, what kind of questions can I answer?
I just have one question. I know I've been asking questions throughout, and you may have the answer, you may not, and it may not be a good question. But I'm just curious, on average, do you have any idea how many man hours it normally take initially to populate the system with the information that we would need for accreditation, if you've had any other health departments that sort of shared their feedback with you?
Well, that just varies so much. I wish I could answer that, but
okay.
You know, depending on what you have already, like for instance, if you have all of your documents created for all 31 reaccreditation measures, then obviously that's pretty well done there. The rest of it is building those documents and then building the plans around the documents in the system. I really don't have an answer for you, unfortunately.
That's good enough.
So as far as, and this is Nick, so as far as the reaccreditation project plans, so that is up to the own health department to create themselves, correct?
No, the plan is already in there for you.
Okay. Okay, well, I was, I know
what we'll do is we'll put this plan in your system. Right now, it's just on our demo. Well, it's on several places.
I think what Nick was getting at was kind of sort of what I was thinking. You know, when you look at all of those domains, you know, the domain has like the domain, the standards, you know, the requirements, and all of that information in there already. And I think the way this system is built, your system has it down to the requirement level as well. Is that correct?
Yes. Yeah. Here's the reaccreditation measures, and then here's the specific requirements to meet that reaccreditation measure.
So as far as the reaccreditation, difference between initial accreditation and reaccreditation is that initial had a lot of documents reaccreditation is mostly narrative. So how would the system help manage or track for that, since it's just someone writing a narrative?
Yeah, basically what it is the information in here is straight from FAB, from their documentation. And basically is all we're doing in this case is helping you to manage the project. It's not going to help you to create the narratives. It's not going to help you to do any of that. It's going to help you to manage the project, make sure that you're on time, make sure that you've assigned specific people, make sure you know how those people are doing against their assignments, that sort of thing. There's no magic in there. It's going to build it for you.
Let me ask you, once the narratives are written, it will allow us to store those narratives in a place where we need to have them until we're ready to upload them. Will it not?
Yes, exactly. In fact, right here, here's we're down under, one of the reaccreditation measures down here. It says describe the ongoing community collaborative process. So that's the narrative that you're going to have. Click on this little guy right here, assign or attach your document, and it's attached right to that specific area, right where you need it to be.
Okay.
So you're saying that that reaccreditation action plan is already in our
No, it's not in your version yet, but I can move it over there in a few minutes.
Okay.
So the question Nick had was one of the things that I was going to ask, is operational plan overview available for viewing on our dashboard? Because I looked before we logged in today and I didn't see this out there, so that was going to be one of the...
it's not there. It's not there yet. No. What I'll do, I'm assuming you guys are just worried about the state one, or would you like the local as well?
We can go ahead and do the local one as well, yeah.
Okay. So what I'll do is I'll put both of these over onto your system. Let me log back in and make sure we put them in the right place there, although they can be moved easily. But.
And while you're doing that, Fred, I think the last time we talked, you had only completed up through domain 3. Have we completed? You completed all of the domains that were still at 4, 5, or 6? Where are we now with that?
They're all completed, yes.
All completed. Okay.
And we can only assign people to projects that are in the system, correct?
That's correct.
So they would have to, so let's say to manage reaccreditation for the state health office, let's say we have 8 divisions that are working on reaccreditation. We could have, and we have 10 licenses under our current package. We could assign maybe 2 people from this office and then 1 from each division.
You could do that, or you can easily expand your licenses.
Documents you mentioned are placed on the server. How large is that server?
Yes. What do you mean, how large? There's no limit. We have as much disk space as you want to use, and we can add more at a heartbeat.
Is there any type of backup for that?
Oh yeah, it's backed up nightly, and it's stored in several different places off-site.
Now, Fred, I think too early on, this may be something completely different because I'm not that savvy when it comes to a lot of, I guess, technology. But I think early on when we start looking at this, a part of this was cloud-based, right?
It's all cloud-based.
Okay. And what exactly does that mean again? Just for a novice like me that's not
basically it's stored on our servers. The only thing you need is a web browser on your end. Nothing is stored on your end. So we take care of all the backups. We do everything for you on our end.
That's what I was thinking. Okay.
So I have a question. You stated for the email notifications, they can go to external and internal partners.
Yep.
Will that is the email able to go to more than one person, or is there only one point of contact that the email goes to?
The email goes to as many people as you want, but those people are assigned as either objective or activity leaders. That's the people that it's targeting to go to the email with. So for every activity, basically it's going to generate one email to the leader, and then that leader can obviously share that with everybody else in the team if they want to. But the leader is responsible for making sure that the updates are done.
This is Pam. Are there different permissions? Hey, are there different permissions for different users so that one person can't change another organization or group's information?
Yep. Let me show you that real quickly. So I'm looking at your users here.
I think
And so this button down here called group links. So I've selected Pam here, and I look at group links, and it's showing me basically that you have read-write access to these groups, but only read access to the other groups. So that's how you set it up. And you can completely turn them off so they can't even see the other groups if you choose to do that.
And who sets this up?
we do.
Your org administrator, whoever you've assigned as the administrator.
Nick is the administrator.
Okay.
And I think we have one administrative, Fred, or two. I know we have users. We have three types of users right now, I think.
Well, let's see. I think Nick may be, yeah, Nick is an org admin, so he can do that. You can set as many people up as you want just by changing this right here. By changing to an org admin, then they automatically have permissions to do that.
Okay.
What else?
Janet, any questions?
I might have one more. Is there a report that shows you like everything in one view, like all of your strategic plan objectives? I mean, I saw the dashboard, but if somebody wants to see all of the objectives listed out and their status, and is there a report like that?
Yep, there is. Let me show you here. Because you guys, let me go back to my little department because you guys don't have any data in the system at this point. So let me go back to here and I'll show you what that looks like. So what I want when I'm going for a report, I want to say at what level do I want to see the report? If I select the department, I'm going to see a report on every plan, every planning element in the entire department. If I want to go down here to just WIC, let's say, and I just want to see everything for WIC, or I want to see everything that's going on with just accreditation. It's that level on down. So if I go to my department level here, I'll tell you what, hello. I'm going to go look at the state accreditation plan. So I'm going to go up to my reports menu here, choose operational plan report. And what this button is showing me, you have the ability to hide services. Typically, if you're going from fiscal year to fiscal year, you'll archive services. So if you want to include those archive services in the report, you can. In this case, we won't. So what it's showing me here is for the state accreditation plan, it's showing me everything in that plan all the way down. If I were to choose the department level, it would show me every group and every office and every program and every plan in the system. And up here, I can choose what level I want to see it at, whether I want to see just the service level, goals, objectives, or activities. I can include the documents that are attached here, and I can set a date range if I want to look at just specific plans within a date range.
Okay, thank you.
Did that answer your question? Okay.
Yes. Yep.
What else?
Sure did.
Anything else, Nick? I'm good. Pam?
No, that's all I have.
Right, I think we're good unless you have something else you want to share with us. I know we're right at the hour we're set up for to go to a meeting, but I think we're good. And I'm sure you know we will be getting back with you to let you know what we will be doing. As I think Jean and I told you the last time when she told you we'll get back with you at some date in the future.
Great.
Let you know.
Here's my action item is to go and add this accreditation project plan to your system. And I was going to ask you where you wanted that specifically to be. Let me go back to your org again here. Where would accreditation fall in your group structure here?
It could either under our division, or I saw public health statistics. But I think I saw where you had it as just a separate. So there you go, yeah, public health statistics. But you had it as like a separate
group.
Yeah.
It'll be a group under public health statistics, if that's where you want it.
Okay, yeah, that's fine.
Is that good? And by the way,
Yeah.
you can move it at any point in time. I just put it there to start with.
Yeah.
Okay, and
The cost of users the last time we met.
Yeah. When does our subscription end, by the way?
Well, here, I'll show you.
Yeah, 20 would be this right here. So, yeah.
5/10/18, it's due for renewal.
How will we know, I guess ahead of time, when to renew that, and how will we go about doing that?
I will be sending you out an invoice for the renewal. If you want to add users at that time, just let me know. I can adjust the invoice, and then you guys just pay the invoice, and we just change this date, and you're up, ready to go.
Okay,
Okie dokie.
Great. Okie dokie. Thanks, Fred.
Thank you very
I
much.
apologize for my lack of voice here, but thank you so much for putting up with me.
Yeah,
All right,
not a
thank you.
problem.
I don't know what you usually sound like, so.
Hey, Fred, now that recording that Nick had asked for,
Yep.
won't it be available? Or how do we get that recording of this go-to meeting?
I will send you a link to it.
Okay.
Great, thank you.
Thank you.
Thank you. Bye-bye.
All right, bye-bye.